Hello and welcome to TheHill's Digital Health Innovation Podcast. TheHill is a digital health catalyst based at Oxford University Hospitals, managing innovation and bringing digital technology into the NHS. Here at TheHill, we're very passionate about needs-led innovation, and a big part of that is understanding the realities of health and care. This series will be bringing you a range of voices from the front line of clinical care, hearing about their daily work and what opportunities they see for innovation and improvement. Hello, this is your host, Megan Morris-Carter, and I'm here today with Emily Lord, who's consultant in sexual and reproductive health at the Churchill Hospital. Welcome, Emily. Lovely to see you.
Hello, nice to meet you.
So, Emily, can you tell us a little bit more about your job and what you do on a day-to-day basis?
Sure. I'm a consultant in sexual and reproductive health, which is basically a mixture of STI care, contraception, and also HIV care. And I'm the clinical lead, so a large proportion of my day is also taken up with managerial responsibilities. I also have an interest in digital health and have been working over the last 5 years to digitally innovate our specialty to bring us up to speed with the rest of the world.
And how did you end up where you are today? What's your career history?
I think I've always wanted to do sexual health since I was a junior doctor, and I did a placement in Leeds in one of the GU clinics there, and I loved it. And since then, I've always been passionate about getting a training number, and coming to Oxford was because my husband was here, and commuting every weekend up the M1 was not much fun. So now we're both consultants in Oxford. So, that's sort of how I got into sexual health, and the kind of digital stuff came a bit later as we went out for tender because we're commissioned by the county council, and that meant that they defined what they would like in a service, and they said that Oxfordshire residents wanted an online service so they could book remotely and have postal kits sent to them. So I was involved in setting that up for the last tender, which obviously we were successful in. So now we're here 5 years on.
Can you tell us a bit more about your experience of digital innovation within sexual health? Because it's a little bit different to the rest of the hospital, isn't it?
For confidentiality reasons, sexual health sort of IT and all the platforms that we use have to be completely separate to the rest of the hospital. People can come to our service and use a completely different name, date of birth. It usually helps if they can remember it if they choose a different one. And it can't be linked. So for the IT system, we had to get a brand new one because our previous one wouldn't support any of the digital requirements of the new contract. Excuse me. So it needs to be able to be safe and efficient for us to use, but to have a patient-facing element that won't allow people to easily hack into the systems. So there were several different elements involved. And I think one of the main sort of things that we had to do was decide who to go with. So we had to run a tender to allow IT companies to sort of come in and show us their products and see which one would work for us. And the firm that we chose, the platform's called Inform, is a really, really nice, intuitive, we call it EPR, which confuses people because it's not the hospital EPR, but it's our EPR. So electronic patient record, and it's very easy to use, and also they're very responsive to what we want, and they will change things and design things specifically that I want.
And how do you find that sort of interaction with, I guess, a computer company or an IT company that's perhaps got that sort of expertise but doesn't have the clinical expertise?
I really like it. It's a different aspect to my job where I'm dealing with companies and talking about kind of finance and sort of 5-year plans, but nothing to do with patients, although the patient care is very important because you want a hospital system that makes looking after people easier. And if you've got all the information to hand in a very accessible way, and patients have ways to book appointments. It means that the care pathway for them is much smoother, and can, especially in sexual health, where sometimes people are feeling worried or embarrassed about their problem. They want to be able to get in to see us quickly, efficiently, without necessarily having to speak to someone on the phone and explain what they need or want.
It sounds like you've had quite a positive experience though with that system.
I would definitely. I mean, they've been a great company to work with. I mean, the whole process was a complete headache. I've never done a project like this before, but it was a good 18 months of my life working with non-clinicians and realizing that you're a very small cog in a very big wheel within the hospital, and shouting and stamping your feet and saying, I need this now. It doesn't really do much good, especially when there's a pandemic that's just about to hit and everything goes into lockdown. So that did hamper us, and it was quite frustrating. But now I sort of have my contacts in the IT field. In fact, actually, they would contact me and say, someone in your department's requested 20,000 tests and blocked the entire testing in the whole trust. And it was one of my colleagues who was leaning on a button on her keyboard without knowing, and there was no safety net to block kind of multiple tests. And I think 20,000 went through the tie, which is like the spaghetti junction linking computer systems together. But they know who to contact as well. So they'll call me and say, what have you done? I'm like, it wasn't me. So yeah, I think it's, really important to get to know people, and so that you can put a face to the name, and likewise.
Yeah, I bet your department was the persona non grata when that happened, because that's quite tricky, isn't it? When the resource is quite small anyway.
Yeah.
So what sort of advice would you give to people trying to go through a similar process? If they are trying to bring in a digital innovation into the trust, how would you approach it? Are there things you do differently? Do you have any particular criteria you apply? Do you think worked really well for selecting?
I think the main thing is to choose your product very carefully, or the company that you're going to work with very carefully. We had several market providers kind of pitching to us, and I'm really glad I went with who we did. It was a gut feeling. All the products, when you're looking them in a nice showroom, look really glossy. But you want to be able to work with people who understand the specialty and the challenges of running a whole system with total anonymity and not linking in with anything in the trust. So I think if the advice to someone starting out is keep calm, carry on. Things go wrong, things take ages. Never believe the Gantt charts that anyone gives you, because you have to times them by about 3. And if you're impatient like me, that can be really, really frustrating. But yeah, I think, I've enjoyed it. I think it's important to have a variation in your job plan and not just focus on one thing, because then you can get quite stagnant. And I think having this kind of digital aspect to my career has been interesting and sort of taken me in a career direction that I wasn't aware that I was going to go in.
One of the things we do quite often with projects is what we call a technical specification, but in a sense, it's more of a sort of expression of the need. Mm-hmm. What exactly do you need this thing to do, and how do you want that to work? And I've certainly seen them extend to several pages, actually, mm-hmm. because you can sort of write it down in one line and then you start to delve into the detail, and it becomes quite obvious quite quickly. You need to specify quite a lot of things about what you'd like the software to do.
Exactly. The technical specification was, when I first wrote it, was really short. I was like, I just want this. And then, the more you kind of realize, if you haven't put it down on there, you might not get it, and you need it be very, very specific. And also there's lots of information governance issues and, forms to fill in terms of where the information is going to be stored and hosted, especially in, a sensitive specialty such as mine.
Did you find that the supplier you went with could do everything you wanted, or did you have to make some compromises?
I hate compromising in general, but yes, I did. I think they have been extremely good at kind of listening and developing things that I think will work, and also then giving that to other customers because they just want to improve the product. I think my main problem is my inability to be patient. And if I have a problem, I want to solve it straight away. Or, as I'm the clinical lead and the digital lead, staff come to me with, every problem they have I want a button that does that, without the knowledge that it takes weeks to months to build one button, and every algorithm you have to think of, and all the testing in the test environments and the live environments, and then when things go wrong, everything crashes. And I'm like, if you really want that button, you have to really want it, and then you have to wait for a year really, really wanting that button, and then if you still want it, then I'll do it.
You sound like a true IT person already.
Learn quickly.
So what other digital innovations are you working on at the moment, or are you looking at?
Well, this year we've been concentrating on our personal health record. Basically, it's like an app, but it's not an app. It allows patients to log into their personal profile, book appointments, request STI kits. If they have an urgent problem, like, for example, people who may have been in contact with HIV or had a sexual assault, they can request an urgent callback, which means that they don't have to try and navigate calling reception and, things like that can be really, really stressful. So this has come later than we had planned because of the inconvenient 2-year pandemic, which slowed everything down. But it's been up and running since March or early April, I think, and is extremely popular. And we can't really keep up with demand. I think we had about 14,000 people registered to do it in the first few months. So it's doing really well, but there's lots of layers and there's lots of modules that you can kind of add on to it. And that's what I'm doing at the moment. So we're trying to make our postal kit system a bit more efficient, and to allow patients to be able to request postal kits for testing for STIs via their app, but then get their results back to the app, because that's a whole different link of information that needs to come through. We also want to be able to enable photo and document upload so that patients can upload clinical photos safely, or letters from their GP that they want us to see to help with their care, and that gets immediately put into their record, and then it's deleted from their personal health records, so there's no sort of data breach for them if they lose their phone. So that's the sort of thing I'm working on at the moment. And in the next 6 months, we want to innovate our PrEP service. So PrEP is pre-exposure prophylaxis for HIV. So it enables people to take pills before they may come into contact with HIV to prevent them catching it. And it's very, very popular. We give out thousands of prescriptions a year. But it's quite a clunky system at the moment. And most of these people are fit, well, people working. They don't have time to kind of come and have a telephone appointment and then come in for a face-to-face. They just want to be able to access something that keeps them healthy. So we are setting up a innovative PrEP project, which we have a grant for, that allows patients to kind of self-triage, go through a triage process, get allocated to a safe group for them, in terms of if you are very, very low risk, you can order your postal kit, get your PrEP prescribed without actually interacting with a healthcare provider. And that means that it's freeing up clinical time for those people who need more time, who may be digitally illiterate or not have access to internet or phones or a safe space to speak. And that means that they can come in and have the more old-fashioned service where you actually see somebody and sit down. So it's really important to offer patients choice that's appropriate for them. So that's next year's job.
I think that digital inclusion is really, really important, isn't it? And there's sort of designing things to be more inclusive and to make sure they're easy for people to access. But I think there is also that patient choice element, and making sure that people do have the possibility of having the old-fashioned face-to-face appointment if they want to.
It's amazing. I think one of the good things about COVID was the red tape seemed to drop for a bit, and it allowed everyone to kind of test the water in something that had seemed so far in advance of what we were doing 3 or 4 years ago. And now it's so embedded, all the online telemeds, it's all staying. And it's great for some people, and for others, it just widens health inequality. So you have to be able to adapt and use it carefully, and not make it be the only avenue that people can get help from.
Do you think that sexual health is a bit ahead of the curve in terms of its adoption of these technologies?
Well, of course. We're a young and innovative service run by a young and innovative consultant. I think that I think it's perhaps easier for a smaller specialty to perhaps, who are already different, to be able to do things differently, because we have a different system. We don't integrate with anyone, which has its problems, but it also means that people don't really understand it. It's easier to kind of get innovation pushed through because it's not really on anyone else's radar within the hospital, because we're not using the hospital systems, so we can't use all the other things that are already there. I think we have been able to get some innovations through because we needed to be able to do stuff, but we can't use all the historic stuff that's already embedded within the trust.
That integration piece is really interesting, isn't it? Because it is a challenge that we find comes up all the time in terms of needing to have the data in a sensible, secure, central location, and yet at the same time, therefore, having to interact with what is actually quite a mature system that can be quite difficult to integrate with, both technically and in terms of the time and effort required.
Yeah, the lab integration was probably the worst month of my career in terms of the complexities. And I think we went live with our new system without any lab integration, and we were trying to fix it. It was literally down to the last minute, and somebody in the tie, which is, like I said earlier, it's like the spaghetti junction of wires where systems talk to each other, and he realised, Sandy, what the problem was, and there was just this switch, and the results started coming in, and I was so happy. Everyone else thought I just was some IT geek just jumping up and down, but I was really happy that it worked.
Yeah, when it works, it's transformative, isn't it?
Yeah. And then it breaks and everyone blames you. But take the good with the bad.
You mentioned that your team, obviously, a lot of them come to you for IT advice and things like that. Do you have a vision for how that could be improved in the future? Whether people could be enabled to use this technology more easily?
I think, again, because we're different, if you call IT help desk, there's not a great knowledge as to our system and how it works and who's hosting it. There's confusion, which makes us more sort of seek internal advice. And I think I'm very much for staff developing their own IT skills and knowledge, and I think it's good for their careers, whatever they choose to do, whether they stay within our department or they go upwards and out somewhere else. So I think learning to use, for example, the data reporting tools to be able to pull clinical information and help you do clinical audit or quality improvement programs would be really helpful. And that's using, Microsoft 365 platforms like Excel, which for me, I can just about navigate with the help of YouTube, and, I need to know this figure. How do I do it? But I think lots of my colleagues would struggle to even do a very simple thing on Excel. And it's when I show them how you can pull the data and interpret it, there is great excitement. Well, not as quite as exciting as I am in terms of when I see data, but they do realise how much time can be saved if you can quickly analyse lots and lots of numbers to help you improve services or prove that you need something more for the services. So, so I do teach quite a lot of people how to do that.
So what other sort of challenges that you experience day to day would you like to have solved in the future, whether it's by digital technology or other innovation? Do you have a sort of hit list of things that you're thinking, oh, I really wish this could be fixed?
I mean, I think because we are separate to the rest of the hospital, and patients don't need to use their NHS number, it hampers us because we can't interact fully with things like radiology. So to be able to make a radiology request, there needs to be NHS numbers and addresses, and some of our patients don't want that. So it means that, we don't have a way of requesting scans for them. We used to do a pink form, we used to call it, and walk it down to radiology, and there was an alternative way for us to do it. But now if a patient won't let us put them onto the hospital system using their real information, then we can't request the scan, and they would have to go to their GP. So that can be a barrier, and it's quite frustrating, and there's no real solution at the moment. I think the other problem that we have with the digital innovation and more remote services that came with COVID they've been really good at widening access in some ways, and have allowed people throughout Oxfordshire to get help and remote care. But because of the prescribing differences between a legal prescription in a hospital is not the same as a prescription in a community pharmacy. And that means that, you speak to someone, you make a diagnosis over the phone, or you give them a postal kit, but then they have to travel to one of our clinics to pick up their medication, which then sort of defeats the object of remote healthcare. So what we want to be able to do is get medicine out to patients, whether that be sending it in the post or being able to partner with pharmacies throughout the county whereby the patient can go in and they have access to our system, albeit not a full access. It's sort of almost like a patient-facing aspect where the pharmacist can have a login to our system and just see that there's a prescription pending for that patient and dispense it. So that's another piece of work we're working on, just to try and allow patients across Oxfordshire to get the medication they need.
How about from that data angle that you were talking about? What excites you about the data sets that you could do in the future?
At the moment, my wish list for the data sets is pretty low in terms of the data published by UKHSA doesn't match the data that we have. And it's been understanding that and understanding why there's such a difference and trying to fix it, because, everyone across the UK uses different systems and they pull data at different times or different months, and therefore you can't compare exactly, one place with another. So my main priority is really cleaning up that data and trying to help identify a sort of standardized data set that can be easily pulled from both the computer system Inform that we use, but also other sexual health computer systems. So we're all on the same page at the start, and there will be discrepancies, but at the moment they're so wildly sort of different to each other that it's very hard to know sort of the benchmark and to know how well we're doing when we're relying on figures that you're not entirely sure are true.
Yeah, the fidelity of data and the completeness of data and the cleansing of it is really, really important, isn't it, to make it useful? But there's huge amounts, I think, that could be done with it.
Yeah, definitely. Yeah, no, and it, it has already informed changes in services that we've been able to run and deliver. So we used our data to prove that there was a need to have outreach, increased outreach support to people throughout Oxfordshire. And now we have more of a dedicated outreach team and a community hub where patients can come and have more flexible care that isn't restrained to an appointment time. And so all of that is sort of, people don't appreciate. It all starts with an audit, an Excel spreadsheet where you prove the concept, we need this care, and then we put the business case in, and then we get the money, and then we get the start, and then it happens. And it's quite a long process, but the start of it is all about data and information.
I think that's a really good point to bring this to a close, Emily. I think you make a hugely good point there. And I'm really looking forward to what you decide to innovate in next.
Well, thank you very much.
Thank you for coming to join us.
No worries.
You've just been listening to Emily Lord talking about digital innovations in sexual health, including working with suppliers, delivering remote care, and upskilling staff to help them make the most of data. I hope you enjoyed this latest in our series on opportunities for innovation on the front line of health and care. If this episode sparks some ideas, or you'd like to know more about The Hill and the work that we do, please reach out to the team on connect@thehilloxford.org. Visit our website, www.thehilloxford.org, or connect with myself or The Hill page on LinkedIn.